How to determine lameness in horses. The reason why I chose this topic is because lameness is actually the most common reason for veterinary examination of horses. According to a really old report that was published by USDA, one half of U.S. horse operation reported having at least one horse with lameness in 1999. An article posted by Vet Times in December 2015 for the horse industry in UK stated that about 19% of horses will suffer a lameness episode each year. As a horse owner or stable manager, if you notice one of your horses is lame, you should call the vet and report the horse's details and history, which includes basically the horse's age, breed, and use to the vet, so that vet can use that information to build a basic picture of lameness before the clinical examination. Clinical examination usually starts with a systematic physical examination of the horse at rest, which ensures the appendicular and axial skeletal elements are palpated carefully. Ideally, the examination should include muscle, ligaments, tendons, and joints, as well as an assessment of foot balance and response to palpation of the horse's neck and back. The flexion test is a really important part of palpation. In fact, it is a good idea to actually do flexion test on your horses every time you group them, because it can help you determine if there is something wrong or if something new comes up. Veterinarians can use flexion tests to identify regions that might be causing horses pain. It usually functions as a good general indicator of the location of a problem in the limb. Flexion tests are used to apply stress or pressure on an anatomical region of the limb for a set period of time, which usually take a minute. Following the flexion period, the horse is trotted off and observed for the effects of the test on gait. Head bobbing at trot is a classic sign of lameness. It is more noticeable in front limb lameness, but it is also seen in many hind limb lameness conditions. Therefore, watching the horse walking toward you is the best strategy to try to spot front limb lameness. If a horse has hind limb lameness, it will often take shorter steps with one hind limb and frequently drop one hip much lower than the other one. Here is a video that I found online of a horse has lameness on one of its hind limb. As you can see from the video, the right hip of this horse moves lower than the other hip as it trots away. It is actually a good idea to record a horse's trot and watch them at a lower speed. It will allow both you and the vet be able to notice more details in horse's gait. As the examination goes on, a vet will be able to find answers of these three initial questions. Is the horse lame? In which limb or limbs are lameness? What is the severity of the lameness? The basic question, is the horse lame, is important. Although horse owners tend to interpret the abnormal gait in horse as lame, abnormality in gait of horse does not necessarily indicate lameness. Lameness in horses are actually defined as a gait abnormality attributable to the musculoskeletal system. Therefore, not all gait abnormalities represent a true lameness. The most common non-muscular skeletal gait abnormalities presented to the vet as lameness involve neurological conditions. The second question is, in which limb is the lameness? The flexion test is a traditional method that used to determine which limb is lameness, and it actually works well for most cases. However, some objective measurement tools for assessing lameness have been developed that use inertial motion sensors, a combination of gyroscope, accelerometer, and global positioning technology. The accelerometer and gyroscope are placed on the head and pelvis of the horse, with a gyroscope on the right forelimbs. The system will provide a vector that indicates the lame lip based on an asymmetry of lip impact or lip push-off. All these measurements of gait are subjective and most easily detected when the lameness is severe, but can become more difficult to appreciate if the lameness is mild. Then what is the severity of the lameness? Defining the severity of the lameness is important for a number of reasons, including determining how the diagnostic workup proceeds, assessing alteration in lameness following nerve blocks or treatment, and for communication with other veterinary surgeons. For diagnosing, there are actually 3 common lameness grading systems that vet might use. Here in the US, a scale for lameness was developed by American Association of Equine Practitioners. The grades lameness from 0 equals sound to 5 equals non-weight bearing lame. In the UK, the lameness is graded from 0 to 10, with 0 being a sound horse and 10 a non-weighting bearing lameness. The last scale is developed by Dyson, and it was developed in 2011, which has a scale ranging from 0 to 8. It separates the lameness into mild, moderate, and severe at walk and trot in a straight line on different size circles. The scale is follows: 0 equals sound, 2 equal mild, 4 equal moderate, 6 equal severe, and 8 equal non-weight bearing. Since no universal agreement exists on how lameness is graded, it is important to stay in communication between veterinary surgeons or in scientific papers which scale has been used so the severity of lameness is clear to the veterinary surgeons involved. After finding the answers for the 3 initial questions, a vet could start on determining the anatomical location of the lameness in horse. Regardless of the experience of the veterinary surgeon in lameness diagnosis, diagnostic nerve blocks are the main tool used to localize the lameness to a specific anatomic region. The general rule of nerve blocks or diagnostic anesthesia is to begin distally on the lip with anesthesia, progressing proximally with additional blocks in a systematic manner. This approach facilitates identifying a focal anatomical region on which to concentrate. For example, with lameness that does not respond to local anesthetic placed on the palmar digital nerves at the level of the collateral cartilages, or subsequently at the level of the abaxial proximal sesamoid bones, but responds to a low 4-point block, the veterinary surgeon would be most suspicious of a problem in the fetlock joint region. The pattern of nerve blocks should never become random. The common exception to the distal to proximal pattern is when a clear synovial effusion is present, in which case intra-articular anesthesia is likely to be the first approach. Also, the distal proximal progression is most likely to be circumvented in the hand-lip lameness for a number of reasons. Therefore, it is important to have an experienced vet perform it on horse. Last but not least, Problems with horse hoofs and shoulders could also lead to lameness in horses. A hoof tester is an equipment that could apply focal pressure to specific areas of the hoof. The primary function of a hoof tester examination is to test for pain response, usually indicated by the horse as a withdrawal of the lip, and this examination could be applied with horseshoes on. These are the references of this video. Thank you for watching.